So my name is Karel Martens from Holland, if you hear by the accent, but I'm working and living in Israel at the moment. And I had a tendency to stand over there because I like to walk around and talk, but then the chair wouldn't see me, so it wouldn't be very nice. So I'll try to do it this way. So I think my worry about, I'm very happy and honored to be invited to this forum. I guess the worry I had before coming here was that we would talk very much about the technical issues of measuring accessibility, and Erik started very well, which are important, and that we then lose out of sight why we are doing this and what we seek to achieve. So in my presentation I want to make it a little bit more explicit how different people see this from my perspective, so I might misrepresent that, and I would like to hear that. And then I will obviously end up with my work on people-centered perspective, which is based on my book Transport Justice. So I'll start with looking at transport as an institution, so a little bit transport planning as an institution, to a little bit understand the field we are active in and part of. And I think it's important to understand this idea of an institution. So an institution has been defined as the rules of behavior, and so North defines it as the formal and informal constraints that structure political, economic, and social interactions. And Ostrom, who won a Nobel Prize for her work on this issue, describes institutions as the prescriptions that humans use to organize all forms of repetitive and structured interactions, including those within church, family, and so forth, but also governments at all scales. So institutions are not an organization, but are rules of behavior. And basically transport planning is a practice that has certain rules, agreed upon rules that guide our behavior and tell us what to do. And when we are behaving well as a transport professional, when we are misbehaving, I tend to misbehave, by the way. So which means basically I'm trying to change the rules, if you wanted to frame it a little bit more neutral. So transport planning as an institution around the world has various formal and informal rules. These are some examples I give in a minute. So basically, obviously there are two sets of rules. One about how you make decisions, how you organize the process, how democratic it should be. And the other, which applies I think more to us as transport professionals, is what kind of information do you process in that process? What kind of analysis do you conduct? How do you prepare decision making? So the professional part. So that's what I'm concerned about. I think that also is where accessibility plugs in. We're basically talking about how accessibility should fit into those existing rules. And these are some rules that we have about how we define transport problems. What is a problem? What is not a problem? This is an unwritten rule. If we talk about assessment, there are formal rules, legal obligations even to do an environmental impact assessment. Some countries require cost-benefit analysis. The use of models is typically an informal rule, but in some countries, if you don't use a typical model, you might actually see your project blocked in court. So there are many rules that guide our behavior, and a good transport professional will just live up to those rules and execute them. And he knows implicitly where he is in the whole game. Now, transport planning traditionally has its roots in civil engineering. So to understand the rules, I think we have to go back to civil engineering. And I was always, with all respect, very critical of engineers, but I've learned to appreciate them. They are very progressive people. So, because the roots for an engineer go back to the 19th century, when we had new technologies popping up, electricity, water systems, sewerage systems, sanitation, gas, and engineers saw it as their ambition and duty to introduce those systems into first cities to improve the quality of life, which was terrible at that time in cities. And they saw it as their duty to actually connect each and every home to that systems. And so water engineers, electricity engineers, their duty was to develop a system and connect each and every home to that system. And that idea of we are responsible for the system, and what we have to do is to provide everybody with access to these new technologies, is something that's rolled into transport then. And transport embraced the new technology of the future, which was the car, and with the car came, of course, the need to buy a high-quality road system, which would then enable people to travel in a much better and comfortable way. And so transport planners defined it as their role to first connect each and every region to that wonderful new road system, the highway system, which was built in many, many countries without any consideration for cost-benefit analysis. And I remember even in the 80s driving on the roads and I thought, where is the traffic? There was no traffic. Well, we just built a road not because of the traffic, because we think and thought everybody should have a proper highway next door. And then later on, of course, we came to manage this system and make sure, just like in the other civil engineers, that it works properly. And properly meant that it works efficiently, at low cost, reliable service. You don't want to have a blackout in electricity, so your duty as an engineer is to provide a system that serves demand to avoid blackout at a low cost as possible. And so we did in transport. Our duty was to provide a well-functioning transport system at the lowest possible cost. And well-functioning meant, like in electricity and water and sanitation, that things had to flow. And so this became the rules of traditional transport planning, and they're written down in handbooks, so I don't have to explain to anybody. We start with modeling future demand, because it takes time to build a road and improve it, so we know the future. Once we know the future, we put it on the network that exists, and we find bottlenecks, links with lack of capacity. Of course, most of us, those who are not urban planners like myself, are especially busy with the models upstairs, and then the economists go more down the line. So we identify links with lack of capacity. That is the problem we have. The transport system is not functioning. We think of new solutions to solve that problem, typically road widening, sometimes a new road, and if we're very advanced, we think about public transport nowadays. Then we're going to assess them, and typically we do this with cost-benefit analysis. A list comes out of projects that are worthwhile to invest in, and we're going to build those new projects. And then we'll go back again, and this way we keep ourselves busy, because, of course, congestion will never be solved. But we have this very progressive ambition, in a way, to connect everybody to a wonderful, well-functioning transport system. These are the rules of transport planning. And this is important to keep in mind if we talk about accessibility and what accessibility can do. So I'll get to this in a minute. So the accessibility shift is, I think, 30 years old, in the sense of 30 years ago, the language of accessibility started to be used to call for a change in transport planning. I think thinking about accessibility is older than that, but calling for change is newer. And if you look at the literature, or my interpretation of the literature, I see two motivations for the shift. So many people are disappointed, and it's formulated that way, with what modern transport systems are doing to society. Yes, it's more easy to travel around by car, but it comes at an enormous cost of environment, landscape fragmentation, resource depletion, livability in cities, traffic safety, accidents, health, and so on. So that's, let's say, the impact-driven critique of transport planning and its rules. And then there is more, I would say, the academic critique is more theoretical nature, or you could say more fundamental. Transport planners were all the time busy creating a system, like with water and with electricity, and focusing on the system and the meaning of focusing on the flow. But it's not about flow in transport, it's really about getting to places. People are moving in the system and not water molecules. And when water molecules are flowing, you can measure the flow. When people are moving, you should wonder why are they moving, and that's what you should focus on. So you should focus on accessibility because that's what people want to derive from transport. And these two things merged and blurred, I think, and I think many people work on accessibility are very critical about the current transport system. So they both use theoretical arguments to promote their societal agenda, you can say, and obviously they're also really concerned about all those negative effects, which are really terrible, of course, just thinking about road accidents. Now then, if you look, what do they propose? I frame two different perspectives, and I'm not sure you can put somebody really in one of those, but I think they're quite fundamentally different perspectives that are there. And so different perspective on what the accessibility shift demands from us, from the transport profession, what it demands from the rules of the transport profession, from the institution to change. So there is a more radical perspective. People that call for a radical shift in transport planning. This is very much driven by all this critique on the impacts of transport planning as it's currently practiced, the enormous impacts on the environment, on health, on traffic safety, and so forth. And so the radical shift actually asks transport planners to become much more open and aware of all those impacts and take them into account in transport planning. And it requires them actually to broaden the goals of transport planning. It's not just about moving people around, it's just as much about creating livable places, about creating healthy places, about avoiding environmental externalities. And so it broadens the goals. Transport planning becomes something else than it used to be. And beyond broadening the goals, there's also the broadening of the toolbox. So where the traditional transport planner is just focusing on the transport system, and all solutions are transport solutions, investments in transport models, transport infrastructures or services. From this radical shift, there is the call to especially think about land use interventions being, in many cases, people suggest, much more effective in improving accessibility. So both the goals and the toolbox changes for the transport planner. That's what I want to see. A completely different role of a transport planner. Now, I share much of this, the ambitions, I think, of this radical shift. But I think it doesn't do a good job to actually convince transport planners to change. And I think for two reasons. I think one is that transport planning actually becomes no longer transport planning. It becomes urban planning. It takes so much into account things that are opposing, point often in opposing directions, require different solutions. It becomes a holistic exercise. It becomes urban planning, if you like, comprehensive planning, if you want. And because of this, it is unclear what the role of the transport planner is. It's not any more clear what is his duty. Where in the old model is very clear, I have to deliver a well-functioning transport system. And that means analyzing congestion and reducing it where possible. That's a very clear duty, and it's very pleasant to work with a clear duty for a professional. Otherwise you get confused and you don't know what to do. So the transport planner, his role, or mostly it was his role at that time, now it's also her role, it becomes blurred. Also what goal to choose, what tools to use, what analysis to conduct, and why is all these things are related to accessibility. So if you are concerned about environmental impacts and about health and about traffic safety and about urban sprawl, why is accessibility the most proper indicator to capture this all? So the suggestion by these people proposing the radical shift is like, if we use accessibility, everything will change, the whole world will be a better place, and all these things will be addressed. It's very unlikely that by measuring accessibility you will reduce environmental externalities, you will improve health, and not even necessarily reduce sprawl, I would argue. So this radical shift is very confusing, and I think that's why it will never, answering a little bit to what Eric raised at the end of his presentation, why it doesn't happen. Well, partly because we've been too radical in a way. We're requiring too much from the transport planner, which is beyond his or her role. Now there's also a limited shift. And these, I would say, people that work on accessibility measurement, they seem to be more part of that limited shift. The argument goes like this: if we just replace the mobility indicators we have now, speed, congestion, travel time losses, travel time savings, with accessibility, that will make the change. It's just about using the proper indicators. Once we do this, change will happen. And so what we have to use instead of travel time gains as the most important benefit of transport projects, we should use something like accessibility gains. And if we do this, that will bring around change. A different KPI, key performance indicator, leads to different planning outcomes. And they have kind of the same expectations. One, if we use accessibility and we plug it in to the existing system, so the rules of transport planning don't really change, we do the same things, but we take out travel time savings and we plug in accessibility gains, then we have different planning outcomes. That's my interpretation. So if I interpret anybody wrong, please correct me. And so, and my concern here is that this is an overly optimistic perspective. Just changing the key performance indicator will not change planning outcomes, and I try to explain this. So accessibility gains. I don't want to talk very long about how you measure accessibility. I use a simple opportunity measure, a set of opportunities. It could be, I guess, a random utility measure. I tend to think in cumulative opportunity measures because I'm just a simple urban planner, and that's what I understand. I also do understand the gravity measure, but beyond this it gets blurred for me for many reasons. Doesn't matter. There's a set, there's a measure that says something about the opportunity set you have. It doesn't matter how you measure it exactly. And an accessibility gain would then be, what will I have in 20 years' time? We just have the same idea of transfer planning, right? We do it for the future, 20 years' time, so I can measure accessibility in the future, assuming I know everything. And that can either improve or go down. And if it will probably go down because of congestion in many ways. And so if I do an intervention, it will increase. And that's the accessibility gain, just a net increase for every person in terms of accessibility. So if I improve accessibility to the city center, let's say, by an intervention, then everybody that has that center in his possible activity set will benefit from the accessibility gain. And we can add it then up. You gain, and you gain, and you gain, and you gain, and all together, this is the total aggregate accessibility gain from a project, right? I think that's kind of an intuitive understanding in a way, because accessibility is about the potential. And if everybody can reach a certain place better, then everybody benefits. Everybody has more freedom to choose where to go. So I think it's a proper way of understanding accessibility gains. Now, if you do this, and you keep the same rules of transport planning, but you just replace travel time savings by accessibility gains, my expectation is that not much will happen. Because first, there are three effects which might occur. First is what I call the group size effect. So if we do this, and we measure accessibility gains because of an intervention, we have to decide who gains from that intervention. Now, if I build a road, then clearly only if you have a car you will benefit from that, right? If you don't have a car, you don't gain more accessibility if somebody builds a road, unless congestion goes down and the bus speeds up a little bit. Now, if you build public transport, you could say virtually everybody benefits because everybody can get on the bus. Virtually everybody is a low-floor bus and so forth. So that will be beneficial to all, but whether it's an accessibility gain for me, if I invest in public transport, will depend on the accessibility I have if I wouldn't use that bus, if I just drive by car. Now, since the car system is currently much faster than the public transport system, investing in public transport doesn't typically deliver any accessibility gain for somebody who has a car at home. On the other hand, the road does increase accessibility for everybody who has a car. The majority of households have cars. Many people have cars. So the group size effect would say that investments in road will lead to many more people benefiting in accessibility and have more aggregate gains. And so, in the end, it will actually support the same thing as is being supported now with travel time savings. There wouldn't be any change, even if you take different groups into account. I'm already making that step. That's the group size effect. There's also the geometry effect. So accessibility increases with the square of the speed. Now, if your speed is already high, the area you can reach is higher. Now, if I improve that speed a little bit, I will add quite a large surface area to the area I can reach. If I have a smaller area I can reach because my average speed is lower, then adding the same increment in speed will not add the same space. It will add less. So again, improving for a low speed mode, which would be walking, cycling, public transport currently, would deliver less accessibility gains than investing in the high speed mode, which would be the car currently. And so again, the geometry effect would point in traditional solutions, which I think many people in the accessibility community think they are undesirable in many, many cases, maybe not always, but in many cases. And then there's the third effect, which is well known, the valuation effect. Well, unless we use equity values of accessibility gains, and we would really do proper cost-benefit analysis, it means take the theory seriously, think that willingness to pay is a good measure of what it gives to society. I don't think it's a good measure, but if we go through the theory, we should use willingness to pay. If we use willingness to pay for accessibility gain, then most likely that would also point again at higher income groups giving more value to an accessibility gain, higher incomes go with a certain mode of availability, and so again it would point towards road investments. So basically, changing the KPI, I think, would just change nothing. Wonderful. I hope. So my conclusion is traditional solutions will still outperform sustainable solutions. And so we did a wonderful theoretical exercise. We came to the perfect measure, and nothing will change. And they adopted it. The transport professionals, they adopted it, and then the results will be the same. I won't give you the anecdote from Holland, but that's what I tried to do there wonderfully. Choose the right accessibility indicators so you will actually keep building roads, which I wanted to do. What do I propose instead? Well, I won't give in 5 minutes my entire book, but a people-centered approach. And so I start again from this wonderful perspective of building, connecting each and every household to this wonderful road system, which in water, electricity, sanitation, gas is a wonderful progressive ambition. Everybody can basically use those systems from age 2 onwards. They're kind of doing fine. Sanitation, maybe at age 3 you're doing it properly on your own. But it doesn't work like this with the road, of course. The road is by its very nature exclusionary. Not everybody can make use of the road. And although politicians in the 60s all said for every household a car, of course only for the man, not for the woman at that time, we never got to that situation, and we will always have a situation where the car will not be able to serve everybody. And I think this holds actually for most transport modes except walking or rolling on the pavement. And so basically what we forgot in this progressive ambition of connecting the entire country to this wonderful road system is that we will always have a certain group of people for whom car driving will be too expensive, and unless we subsidize it, but we have quite failed in that. People who are not able to drive cars for whatever reason of impairment, and young people who are not allowed to drive a car but already able to travel on their own, they will not be served by that system. And the fact that this is the case means that we cannot focus on the transport system. Focusing on the transport system is fundamentally wrong, and Florida already pointed this out in a question. We should focus on people. And that's what I try to argue in my book. It's called Transport Justice, but it basically proposes a different way to do transport planning. And so what I did was, maybe now it gets too long for the 3 minutes that are left, Mr. Chairman, a thought experiment. So I'll skip the theoretical and the philosophical construct of a thought experiment. What came up was, I basically defined a right to accessibility. So what came out of the philosophical thought experiment was that if I don't know who I will be and I have to design the transport system, I will design it in such a way that no matter who I will be in society, I might be poor, I might be disabled, I might be that young child, I might live in the center or in the periphery, I might be old and frail or very fit, I will always want to protect myself by wanting to have a transport system that serves me, no matter who I am. And the other way around, this means every person is entitled to a sufficient level of accessibility. Framed in engineering terms, it means we have to provide a fair transport system, a transport system that provides sufficient accessibility to all. And that means, and that's the difference from the accessibility shift, which basically says we keep everything the same and we just accept the problem definition of the transport planner as congestion being the trouble, and we just change the metric. We have to define a different transport problem, because if you say that a fair transport system provides sufficient accessibility to all, then the mirror image is, of course, wherever I don't provide sufficient accessibility, that's where a transport problem occurs. And only there, where there is sufficient, there is enough. I don't have to act. And so transport planning then becomes the field of government intervention that seeks to guarantee sufficient accessibility for all through interventions in the transport system. And I added the last part to make sure that transport planners know what they have to do. We can improve accessibility also through land use, but it's not the duty of the transport planner. He should identify when transport fails to, in its share, to provide sufficient accessibility. Sometimes it's not transport, it's just a lack of destinations. In many cases it's transport, and then we should act. Maybe jointly with land use, but also we as transport professionals should act. So what this people-centered perspective does is it changes the problem formulation, and in this sense it's even obviously more radical than the limited accessibility shift, but it's less radical than the radical accessibility shift, because that requires something from a transport planner the transport planner cannot deliver. It requires a transport planner to become an urban planner, which is not what a transport planner is. We should clearly define the duties of our profession. And these doesn't mean we shouldn't stop talking to other people. We should talk much more to other professions. But we have a certain expertise, and that's the expertise we bring to the table. And it's called improving transport systems to provide sufficient accessibility. That's our duty. And so, to conclude, we should keep in mind in this 1.5 days we have that just talking about accessibility measures and replacing travel time savings with some kind of accessibility measures will not do anything. And so we have failed. If you share the ambition that we should design a more human-friendly transport system that also serves everybody, then we should do more than that. We should redefine the transport problem, and that means basically focusing on people and not focusing on the transport system. It means that is a difficult step for engineers. Okay, engineers don't like people. They're an obstruction. And just to give an anecdote, in Israel, the Public Works Department had 3 land uses in their plans: roads, future roads, barriers to roads. And that's all they had. And I think they should see people, 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 and how do we serve them. Thanks.